This is what you're doing right here as a chiropractor, amongst many things, when you apply physical medicine. This is called the piezoelectric effect. When you're adjusting somebody, how are you affecting them in the ways you're adjusting them? Well, one of the ways from the collagen standpoint, is the piezoelectric effect. And this is what happens. It's the ability of certain materials to generate an electrical charge in response to applied mechanical stress. The word piezoelectric is derived from the Greek. Piezo means squeeze and or press, and piezo, which means push. Now, this is exactly what's happening in the chiropractic adjustment. You are the piezoelectric effect. You're applying mechanical energy. It's kinetic mechanical energy. It's a high velocity, low amplitude. And it's in the paraphysiological joint space. It's not active range of motion. It's overpressure, and especially in the paraphysiological joint space. You are applying this mechanical energy, and that mechanical energy is transferred into electrical impulses, is what affects this tissue. These collagen fibers and these cells, just like Wolff's law on bone, is determined by stress. That stress is mechanical energy that stimulates an electrical response. The cells, the bone cells, and in this case, the soft tissue cells, are electrical. And that's how they respond. They respond to positive and negative charges through either production or resorption. And that's what's happening with this collagen with the piezoelectric effect. And this is how you're affecting this collagen. And it's happening in the repair phase. This is what's happening in the repair phase. And of course, how much you affect it in the repair phase depends on how it's going to heal. That's that example of wet cement. There's no more collagen produced in the remodel phase unless there's re-exacerbations that are piled on. And that's what I call the 4 dimensions of an injury. Very few times is our injury is just one-dimensional: inflammation, repair, and remodel. And the primary reason is people have to work. They have to do things. And that's why these phases of healing overlap. That's why you can have inflammation tissue in the remodel phase. You can have repair phase collagen production in the remodel phase. Okay, so you have these 4 dimensions of an injury. But being aware of it, so from the physical side, chiropractic is affecting this collagen tissue. First, it's helping to align it, and that's through the dynamic stress lines. When you're adjusting in what's called the line of drive, and chiropractors know what that's the line of drive. Those are called stress lines. And the reason we want to do those in the line of drive is because that will increase and stimulate the piezoelectric effect and the collagen synthesis and the alignment of the collagen fibers, which will increase the strength and elasticity. The strength is through aligning the fibers, and the viscoelastic effect, the plasticity viscoelastic effect, is what affects stretching and mobility. And so that's what happens with the physical medicine chiropractic from the collagen to help mobility and strength. Now, how chiropractic works with increased nerve sensitivity and increased number of nerves is different. So the physical medicine of chiropractic now looks at stimulating the mechanoreceptors receptors, and it's based on the gate theory, the neurological pain model of the gate theory, and stimulating mechanoreceptors. So that's what physical medicine does to help with pain in the neurological category, with increased nerve sensitivity and increased number of nerves. How it affects the collagen fibers is the piezoelectric effect, aligning them. The angle of stress stimulates not just the healing and the alignment of these fibers, but also the viscoelasticity of those fibers. In other words, the mobility of those fibers. That's what happens, as well as the strength. As we line these up, the tissue gets stronger and stronger. And of course, hopefully that's in what's called the line of drive. Line of drive means the normal arthrokinematics of that joint. The more we can normalize the intersegmental arthrokinematics movement of that joint, the more we're decreasing and limiting the potential for aberrant motion and the pathology leading altered arthrokinematics. That's a pathology, altered arthrokinematics, leading to osteoarthritis. And this is exactly what you're doing. So the reason we're pointing this out is when you're coming back to these phases right here, the sensory component of the patient, the nerve sensitivity and the number of nerves, those will be reduced relatively quickly. And usually within the first 30 days, I mean, usually in the first, from a chiropractic treatment, as a chiropractor, I don't know if you know the statistics, but 1/3 of patients feel better on the first treatment, the very first treatment. So as a chiropractor, if you treated any kind of patient, patients respond, they start to feel better pretty quickly. Well, that's the neurological component, the mechanical receptors and the gate theory that you're helping here, as well as helping reduce the inflammation. Because remember, there's 3 reasons for pain. One is direct nerve damage, and that's not typically what people are dealing with. And then there's inflammation, and what causes the inflammation is the abnormal pH balance of the intracellular fluid. That's what causes pain, the differential in pH, acidity, alkalinity of the tissue. That's from inflammation and cell damage. And then the third one is psychogenic. Those are the 3 causes of pain. So almost overwhelmingly, it's cellular damage, and then secondarily, direct nerve trauma. So my point is these will respond quickly. These will respond quickly. And if that's what your care is based on, that's all you'll get. The collagen fibers, number 3 and number 4, does not respond quickly. That is not a first phase treatment protocol. That's a second phase and third phase treatment protocol. So we expect the patient within the first 30 days to feel significantly better. But we already know it takes anywhere from 6 to 8 weeks post-injury. We already know from biopsies that that's the time period of the repair phase in the collagen synthesis. So we know if nothing is happening, if there's no piezoelectric effect, we're not helping that patient with the collagen and the healing process. And then also, if we're not doing anything with resistive exercise, we're not doing anything with that collagen to help increase its strength or its viscoelasticity. And this is where most of the chiropractors are missing the ball. The whole focus is on the sensitivity, and those clear up relatively quickly. What does not clear up, in other words, the symptoms clear up quickly, the tenderness clears up relatively quickly. Typically, they don't have a reflex or a dermatome problem. Their joints don't clear up quickly, but they'll typically clear up. The range of motion, the active range of motion will clear up quickly. The passive or the overpressure motion will take a little longer. The intersegmental motion is what takes longest because we're dealing with the collagen and the repair and the remodel phase. That is what is going to take time with physical medicine. The strength, we typically don't have a problem, but if we did, that's a collagen time issue also. Nobody works out 3 days a week for 2 weeks and gets bulk in their muscle. That's not how it works. We're talking about collagen synthesis, the normal biology of healing. And the x-rays are just measuring. All we're doing with the x-rays is measuring the altered arthrokinematics. We're measuring the ligaments, the tendons, the fascia, the joint. In other words, all those tissues that were inflamed. That's what we're measuring. So we're just measuring the relationship. That's telling us how that's our guide. Now, one of the best tools, to be honest with you, it'd be great if we did the motion x-rays and we just did a computerized radiographic mensuration out of all the x-rays, and then we just totally based the care on that. Or not the total care, but the physical medicine part of the care. Because now we know how we're affecting, which joints we're affecting, where to apply the piezoelectric effect, and how it's responding. We can measure that. And this is what should be measured. This is what should be high emphasis. This is what will take the repair phase. This will not happen in the first 30 days. This will take 30 days to 90 days to affect that collagen strength and elasticity. And the same thing with the disc space. We're talking about collagen. The disc is, after water, it's collagen. And so we're talking about the exact same thing. And so this is where in the lumbar spine, we're going to look at left and right lateral bending, and we're going to look at coupling. And this is why we're paying attention to these intersegmental motions with lateral flexion and rotation, the spinous process. And this is where there's high emphasis. And this is the collagen that we're affecting in the repair phase of healing and the remodel with active therapy. This one you can see the bones are locked up. There's not, each segment's not tilting. So the active range of motion, this person, this lady has, I'm sure, totally normal active range of motion and right lateral bending, full. But intersegmental motion is totally messed up. There's no tilting at all here. There's some here. It's locked up here, but there's not a lot of movement between L5 and S1 anyway, but between L4 and L5 there should be. So there's some movement here. There's very little. Most of the movement is between L3 and L4. And so where most of the movement should occur, there's no movement. It's very locked up, and we have no rotation. All these spinous processes are just kind of right in the middle. Remember, in the neck and the lower back, the spinous process in the neck will go to the opposite direction, and the lower back, they'll bend into the same direction. So you have abnormal coupling here with right lateral flexion and rotation. Well, that's a collagen issue. That's what that is. That's a fixation collagen issue. So from a chiropractic standpoint, I would feel that a lot of times you'd have tenderness here and all that, but this is what caused, when this continues on, this is the process of arthritis right here. This is altered arthrokinematics. And this is a major biomarker. You should be putting a lot of attention in. It's the collagen phase. You should be directing the patient into this, because this is what's going to determine the long-term care of that patient. The long-term care meaning how they feel. And then that's an example of the neck. That's more of a normal neck flexion, extension. And then you look at, that's another extension. So let's go to a flexion picture here. And here you can see abnormal coupling here. Remember, you're looking at translation and angulation. So here we have a break in George's line. So that just needs to be measured. So that's definitely an altered intersegmental motion, and it's all probability, OMSI. And then you don't, look at this. We don't have any flexion. This patient is bending their head forward, and none of these bones are tilting. That's about as stiff as it gets right there. And then we have an exceptional amount of motion in this here, definitely where the post-injury is at the, what is that, 1, 2, 3, 4, 5, 4 and 5. But between C2, 3, and 4, there's no intersegmental motion at all. That's aberrant motion. That's a problem. And then same thing there is you have significant moment L5, which there'll be more motion. Then you have a motion at L4, and then not much between L2 and L3. So, some of these you can eye, and also I'd recommend just drawing a line, taking a ruler and just drawing a line at the inferior plate of the vertebra. You'll help see convergence and divergence, and that will help visually show the patient where there's more motion or less motion. But optimally, what would be great is if these were measured, and then the patient not only saw it, but it was measured in degrees, and then they saw normal versus abnormal. And that's exactly what you're doing with physical medicine as a chiropractor. And remember, it is the chiropractic adjustment. Remember, it's the chiropractic adjustment that gives the greatest piezoelectric effect. That's because that's where there's the highest mechanical energy, not in active range of motion and not overpressure. It's the high velocity, low amplitude. That's what affects the collagen the greatest. It has the greatest impact. And so these are some of the major components of, these biomarkers and what their treatment schedule should be based on. So let me return to this and do a little math. So remember what determines how the patient heals is how old they are, and how long they've had the problem. Those are the two largest factors that's going to determine the quickness of their healing. And so when we take these stages, let's go ahead and do a little numbers here. So we know in the inflammation phase, that's going to be 4 treatments, 72 hours inflammation. And we're being very generic here. Well, we know the repair phase is from 6 to 12 weeks. We know biologically that's when collagen is deposited. Even if it's an old injury, remember you still have the new injury cells going through this same process, even though there's possibly old permanent injury there. That's called the 4 degrees of an injury. It's not black or white. It's not linear. And so that's 6 to 12 visits. In the remodel phase, we know that's from 9 months to 12 months. So let's just do some real easy bulking here. So if we're doing a report of findings, they're already at the 4th day, so we don't even, those are the first 4 visits. Well, let's go to the very low end. If it's a young person with no permanent injuries, then they're at the very low end of the repair phase of healing, which would be 6. And then, of course, we would want to treat them 3 times for 6 weeks. Why? Because of the piezoelectric effect. It has to do with frequency. So if you're not applying the piezoelectric effect, there's no mechanical effect that's stimulating an electrical response to the collagen. You're seeing them twice a week in the repair phase. So it needs frequency. That's the physical laws. So that's 3 times a week for 6 weeks. So that would be 18 visits in the repair phase. And if we went to the low end on the remodel phase, because it's a young person with no injury, so let's just say once a month for 9 months. And all we're doing is bulking them. We're not going to say it's going to be 9 months of care. We're just bulking the treatments. So if that would be 9 treatments. So at the very low end, somebody who's normally healthy and young and no permanent injuries, the total visits would be 4 visits for the inflammatory phase, 18 for the repair phase, and 9 for some active therapy. Everybody should have some form of active therapy to affect the strength and viscoelasticity of that new inflammatory repair phase tissue. So you got 18, 4, and 9. So that's 31 visits. So the very low end, based on the physiology, is 31 visits. If we went to the high end, in other words, it was an older person and they had ongoing long-term injuries, then we'd go to the 12-week period. So if we said 3 times 12, that's 36 treatments. And if we said once a week for 9 weeks, 4 times 9 is 36. So if we added that up, for the total long end, that'd be 4 visits in the inflammatory phase, 3 times a week for 12 weeks in the repair phase. And then if it was at least once a week in the remodel phase, you're at 36 visits. So the high end, you're at 76 visits. So this is how, and this is, by the way, this is how I justified care. This is how I justified the need for care. This is how I documented care. This is how I never had to give money back to an insurance company. I don't remember ever having, especially a personal injury case, ever having them taken out from under my care. And this is why I never lost in court. This was the information, and this is why I did the therapeutic protocol I did. So if they were in the inflammation phase, my therapy, they were seen daily to reduce the pain and inflammation as fast as possible, and they were used pain-reducing and inflammation-reducing therapies, and I could explain what they were. And then in the repair phase, they were still some modification of pain or muscle, depending on the patient's exams and the SOAP notes. But that's when we would transition into more active therapies also, depending on how, their comfort level. As soon as they can move the full direction without pain, we start active therapy. And then, so I was able to explain what therapy I was using in the repair phase, and specifically chiropractic. And in other words, how it was affecting nerve sensitivity, increased number of nerves, the collagen mobility, or the collagen strength. And this is how I justified and explained the frequency of care, the therapeutic protocol, and the cost for treatment. And this is exactly what your care should be based on. And so it should not be based just on symptoms and inflammation. Those are going to be the first ones to leave early. And then you're going to leave this person with a permanent injury. So you're going to help their pain and inflammation. They're still going to be in the repair phase, but now you're not treating them because you don't have the belief system and you don't have the conviction and the confrontation to ask for time or money. And now next thing you know, this person's not getting the piezoelectric effect in the repair phase or the remodel phase. That collagen now is healing wrong. You have altered orthokinematics, and now you've just set them up for arthritis the rest of their life. That's what you have done. And so what I say is at least give all of the patients this information, whether you think they can afford it, not afford it, whatever. Give everybody the opportunity to make their own choice. And then you make it affordable for them. And because we will go to terms. It doesn't matter if it's 76 visits and $2,000 or $3,000. That's not the point. We will make it affordable. If it's $75 every 2 weeks or $150 every 2 weeks, we will make it. We will break down those terms and make it affordable. That is not the point. The care is the point. Matching their care with the biomarkers, and then comparing that into each of the phases of healing. And that's how you should approach your treatment protocol. That's what it should be based on.